overall, over time, that skin health is so important. And these regenerative treatments are really what focus on the skin health. People are really drawn to natural looking results. They don't want to look overdone, right? They just want healthier skin, better structure, textural improvement. And the shift towards regenerative aesthetics really supports those goals.
Welcome back, friends, to the Erie Wellness Podcast, where we explore a wide range of health and wellness topics, highlighting the incredible local professionals right here in our community and encourage you to advocate for your own health and well-being. Today's conversation is one that I'm really looking forward to because I believe that skincare and beauty are really part of a well-rounded health and wellness routine. When I feel good in my own skin, I show up so much better in my roles as wife, mom, business owner, and friend. There's something powerful about confidence and feeling aligned in your body. Today, I'm sitting down with Tori Cohen, co-founder of Bare Radiance Aesthetics, a local med spa here in our community. Tori, welcome to the podcast.
Thank you, Lauren. Thanks so much for having me. I'm excited to be here.
I love that your background started in family medicine before moving into aesthetics. What led you into this space, and how has that whole person approach shaped the way you care for your patients today?
Absolutely. So I started out in family medicine. So my background is a physician assistant, and I practiced at a local family medicine clinic for 4 to 5 years prior to branching out into the aesthetic world. And I really love that my background started there. And the reason I love it is because it really allowed me to take a whole person approach to any sort of problem. So we don't really look at just one problem or condition in isolation in family medicine. We really take a more holistic approach. And we know that the way you feel mentally, emotionally, hormonally, and physically kind of all interact with a problem. And so I was able, when I started aesthetics, I was able to take that background of a wholehearted approach and really good listening skills and implement that into my day-to-day here with clients. And kind of like you alluded to, when we as women, and just in general, there's so many transitions that we go through in life, right? Whether it's pregnancy, postpartum, perimenopause, postmenopausal, right? And so there's all these factors that influence ourselves and our well-being. And so when we are assessing someone in our treatment chair and they're coming in for a consultation, we're not just looking at the sunspots. We're not just looking at the wrinkles. We're kind of looking at what's your lifestyle like? What treatments do you have time for? What is hormonally going on in your body? What stressors are impacting, your skin and the way that you're feeling? And so I feel like that background approach from family medicine has really made me well equipped here in aesthetics and really taking that whole person approach. Another thing too is just the background of anatomy and physiology and antimicrobial agents and antibiotics and all those things that kind of people come into my chair and they're on, I'm on this medication from my doctor. Is a safe treatment for me to do? And so I'm able to kind of answer those questions and say, instead of referring back to your doctor, here's the way the medication works. Here's my guidelines. I'm still a practitioner licensed by the state of Colorado, so I maintain my license. And I think that gives people a lot of confidence coming into treatments with me because they know if there's a complication, I'm authorized to diagnose and treat that. And so I think that just gives people some confidence in our ability to treat and care for them.
Yes, I've noticed a lot, even just on your social media pages, you guys continuously talking about just like a well-rounded approach to wellness, sleep, water, all the basic foundational things that we need, and how it can show up the way that we feel and how our skin looks. So, and then two, going along with, it's great that you do have that like medical background because understanding what you're taking and how some of the aesthetics can impact it is huge because you don't obviously want any adverse side effects or anything like that. So that's really important.
Yeah, absolutely. I mean, I think we actually, for example, we just had someone in our chair last week and she was on a course of steroids because she's coming off of some sort of bronchitis. And she was in for a microneedling treatment. And I told her, I don't think this treatment is going to benefit you today. Not that it's not safe to do, but microneedling, we rely on your body's own ability to heal and to build collagen. And when you're on a steroid, your immune system is dampened. That's the whole purpose of that medication. So, she wouldn't get the best response from that treatment that day. And if you're going to invest money into something, I want you to have the best response. So we sent her home and told her, come back, 7 to 14 days after you're finished with your steroid course, and we'll get you back on the books for a treatment. But I want what's best for you, and I don't think that's the treatment today. And so I think that that's important as a provider too, is understanding the limitations and saying, no, I don't think today's a good day, and here's why. But I think that the medication background that I have really sets us apart, and we're looking out for our client's best interest all the time. It's a client first approach.
I value that because my time and money is important too. So
yes, absolutely. And I would want someone to do that for me. I tell my clients all the time, I'm not going to do anything to you that I wouldn't do to myself. And I think leading with that, and our whole team leads with that, is really what gets us the retention of the clients that we have and the new clients that are walking through the door. So that's kind of a mission that we always stand by here.
You talk a lot about enhancing what's already there versus changing someone's appearance. So what brings you the most joy in helping clients feel confident in their own skin?
One of the coolest things to see as a provider is clients that come back and they feel reconnected with themselves. And I feel like confidence has such a different meaning for different people, but whatever transition people are going through in their life, just bringing back a little bit of whatever their concern is to kind of realign with themselves is one of the coolest things. And we do so in such a natural way. Aesthetics industry has this stigma of looking fake or overdone or things like that. And when we can kind of show proof in the pudding of, look at our before and afters, come in and take a look at Katie and I. And if you think that we look overdone, then we're not the place for you, right? But if you think the team looks like people that you want to look like, and we reflect the models that you want to be, we can instill that. And with small changes, we're not talking about doing overhauls on people. And confidence in people's skin can be something as little as, hey, let's start on a vitamin C to brighten that skin tone and texture. And we can really leave it at that. And it's so fun to be able to, it's rewarding to sit in this chair, to form relationships with clients. An example of a most rewarding experience I had, actually, it was more medical. So we had a patient come in and she had something called Horner syndrome. And Horner syndrome causes an eyelid ptosis. So it's essentially when you have that lid drop and it looks like a droopy eye. And she had it was a complication of, she had surgery for a tumor, and that complication happened. And she said, my oncologist and my surgeon, they said, I'm going to have to live with this, and maybe the nerve will re-stimulate itself in a year. But she's an active mom. Her kids are in sports. She's like, I don't want to be on the sidelines feeling like I have to constantly wear glasses. Is there anything that you can do to me? Right. And it was so rewarding to have her sit in my chair. And I said, I'm sorry that you were told that there was nothing that anyone can do. Here are the options. We can put some Botox to relax some muscles in that area. We can prescribe some prescription strength antibiotic drops to help open and stimulate that eyelid. I don't know the relief that they're going to get you, but I think it's worth a try. And we did both things. And she sent a text message to me actually probably about last month and said, I'm so happy I found you. And I think that she was like, my confidence is improved. My eye is open and alert. I just feel really good. And I think that those are the little moments that we take and we hold with us, and they fuel us forward. And so it could be something as little as listening to the patient, being honest with them, saying, look, these are the treatment options. They haven't been tried before, but I'm happy to walk your hand and walk that path with you. And then to see some improvement of that was so exciting for her and so impactful for her. And that means it's impactful for me. So I think that those small little joys that you can have and touching people in their lives that way is something that's so rewarding.
No, you're right, Tori. And everyone has something that they're a little concerned about or worried about, even if it's not noticeable towards other people, maybe not necessarily, but you notice it. So it's so important just to be open and just look for what tools and things can help you for sure.
Exactly.
There's a big shift towards treatments that support your body's natural ability to heal, like PRP, Sculptra, laser, and microneedling. Can you break down these regenerative aesthetics and what they really mean and why so many people are leaning into them nowadays?
Absolutely. So we are a huge fan of regenerative aesthetics here at Bare Radiance. And the reason we love it is because we're working with your body and not against it. So we're using your body's own capability to heal the skin in whatever capacity that means, right? With microneedling, we're building collagen. There's actually a study that shows in a series of 4 of microneedling spaced 4 to 6 weeks apart, it will increase your own collagen by 400%. That is not doing anything fake. That is not doing anything foreign to your body. That is literally causing a controlled wound and allowing that wound to heal and leaning on your body's own capability to heal. And so I feel like those lasers is very similar to that mechanism. PRP is when or PRF is when we draw your blood, we spin it down, we take those growth factors, we call it the liquid gold, and we can inject those back into the face for regenerative capacity. So, firmness, helping fine lines and wrinkles, making skin appear brighter and tighter. We've been doing things like PRP in knee joints and shoulder joints for regeneration for medical use for a long time. And so being able to bring that into aesthetics has been really, really exciting. And it's a whole shift. When we talk about regenerative aesthetics, you really get more longevity out of those treatments because we're working with your body to heal and to stimulate itself. Sculptra is one of my favorite injectables. I get it done and I love it. We inject a molecule called a PLLA molecule. That poly-L-lactic acid molecule stimulates collagen and elastin by creating an inflammatory response underneath the skin. And then it's broken down into carbon dioxide and water and excreted. So I always joke, you pee it out and you breathe it out. And the only thing that's left is your own collagen and your own elastin. Overall, over time, that skin health is so important. And these regenerative treatments are really what focus on the skin health. People are really drawn to natural looking results. They don't want to look overdone, right? They just want healthier skin, better structure, textural improvement. And the shift towards regenerative aesthetics really supports those goals.
Mm-hmm. So for someone who's like, I'm not ready for Botox, that seems too much. Like these are going to be great because it's really just using your own body to help heal itself.
Absolutely. And I love Botox, but it's a higher maintenance treatment, right? It doesn't change anything about the skin. It just freezes the muscle movement for fine lines and wrinkles. Mm-hmm. So I always joke that we can tell the people who have had Botox and filler their whole life, but haven't leaned into their skincare, right? Because it'll be frozen, but it will still look 50 or 60-year-old skin, right? Like the skin health doesn't change unless you do something to the skin. Mm-hmm. Where microneedling, Sculptra, lasering, medical grade skincare, all of those really focus on your skin health. So, the combinations that we pair here at Bare Radiance, we look at your at-home care. The number one priority for us is your skin health. Like we don't jump to injectables first line. We want to make that skin healthier and more resilient because when the skin is healthier, you see less fine lines and wrinkles. So I think that that's just an approach that we take that serves our clients really well.
And it probably is more treatable. The healthier your skin is, the more it's going to respond to treatments too.
Totally. And the more resilient it is in everyday life. Right? Mm-hmm. It's like if we have, I always joke, think of your skin like a piece of tissue paper and we crinkle that tissue paper up and then we try and flatten it out. You are never going to get every fine line and wrinkle out of that tissue paper. But if you take a duvet and we crinkle that duvet up and then we line that duvet out, it's not going to have nearly as many fine lines and wrinkles. And focusing on your skin health, that's what happens. We're taking this thin sheet into something that's thicker and more resilient. And that's going to age you really, really well for the days, months, and years to come.
Mm-hmm. I have a question. So you mentioned collagen at the beginning. What about people who are like, well, I'm already taking a collagen supplement or something like that? What's your thoughts there?
That's a great question. So taking oral collagen is great. It helps with skin, it helps with nails, it helps with hair. But when we're really talking about making corrective change to the skin, you need to treat the skin from the skin level. So what that means is taking collagen in a supplement is going to help your skin age better, but it's not going to regress or correct any of the treatments that you're needing to the skin, if that makes sense. It's not going to provide any corrective capacity to the skin. You really want to identify that from the skin level. So I think doing both of those things is great. When we're really focused on building collagen, I really like to look inwards towards the diet because protein is a building block of collagen. So I tell patients, if you are on a low protein diet, or if you're on a GLP-1 and your micro and macronutrient because you're not getting food in, right? Your body is not going to stimulate as much collagen as someone who is getting 100 to 120 grams of protein a day. So we really need to kind of look at internally what's going on and what's going to maximize these regenerative treatments, because I want you to get the best bang for your buck in my chair. And that's giving you some homework to do at home too.
I love it. That's where your PA background, comes in, and you're telling people that all the stuff they need to be also doing behind the scenes that is going to build that foundation.
Absolutely.
Another question that I thought of. So collagen, you said it's great. But would you say, what's your top 2 supplements? Maybe vitamin C, vitamin D, I always hear is so popular, but for skincare.
Yeah, I agree. I think for skincare itself, it depends on what we're trying to treat. That's why it's so personalized. When we talk about supplementation, I don't think it's a general guideline of everyone should be on vitamin D and everyone should be on a collagen supplement and everyone should be on vitamin B12. We know that some supplements actually trigger acne in patients. So when you have a high level of vitamin B, that can really contribute to jawline acne. So I think it's really important that when we're building a treatment plan and recommending supplementation, we do so in a way that's really personalized to them. There's some studies that show, if you tend to lean towards injectables like Botox or Dysport, taking a zinc supplementation before your treatment can help increase the longevity of your results. And so I think that the supplements that we recommend are really personalized in the treatment room, and it's hard to put a blank statement that everyone should be on these 3 things. I think we should look at the blood work, we should look at your gut health, we should look at the skin, see what your objectives are, and then recommend from there.
No, that's what I'm hearing across all of the wellness professionals that I've had on the podcast. It's so individualized, which is hard because I think social media throws at you all of these things. If this influencer, this person, they have great skin and this is what they're on, that's exactly what I need to be taking. And it might not work for you. So you have to be really explorative and just trying to figure out what's best for you personally.
Exactly. And I think that when you sit in a treatment chair and you are vetting your providers, right? The thing is TikTok influencers, Instagram influencers, all of those things, we need to figure out what their credentials are. And I think that that's something that our clients bring to us when they sit in our chair. They feel so overwhelmed. They're like, I bought these 12 things. I think this is from Korean skincare. I don't know where this is from. And what order do I put them in? How do I use them? And I take each product, I deep dive into them. I say, what are the ingredients? Who's the manufacturer? What are the clinical trials? Because I always say, if something is going on my skin, it better have a clinical trial that shows that it decreases or improves something. Because why waste my money and put something on my face that I don't know if it's going to work? And so sitting with a provider, and you guys don't need to be the experts, right? That's why you come to us. We're the experts. And your skincare needs are going to change based on the season of life that you're in, based on if you're in a drier climate, right? If you're listening to someone's TikTok that's in Florida and there's very humid weather, their products are not going to suit us here in Colorado where we're so dry. Right. And even for myself, I have to change my moisturizer when it comes to summer season versus winter season because it's so dry. So I need something thicker and more dense in the winter. But we don't expect y'all to know that. We just expect you to sit in our chair and listen to the people who have a background in this and who do a lot. We vet for you. We do all the vetting, all the research studies. We do them here so that the information we provide you is science-backed, it's result-driven, and we can feel really confident in the recommendations that we're making.
So when you sign up for one of your services, it's not like you just come in, you get the service, and then you leave. Can you kind of share what it looks like to be a client of yours?
So we think the initial consultation is so critical, and that's why we offer it complimentary to every client that sits in our chair. And the reason for that is because we want to be realistic with you and outline. We go through 3 or 4 pillars with our clients, and we say, look, we're going to be diving into your at-home skincare routine. So bring everything that you're using with you, and we're going to say, these are the products that we want you to prioritize, and here's why. The second thing that we go through is focusing on skin health. So whether that's leaning into microneedling, Sculptura, PRP, lasers, what are we going to do to build that skin integrity up? Then we're going to look at another pillar of, what does your lifestyle look like at home? What are we putting in our body? Are we out in the sun all the time because we're at kids' games or we're at a vacation in Fiji? Like, what is going on in the next few months in your life? What downtime can you allow? Are you a CEO and you can't go into work with a red face post laser, right? So, and then once we kind of dive into a little bit more of that holistic nature of the individual person, then we kind of spit out a treatment recommendation and we say, look, these are the things that we want you to prioritize, whether it's in your diet, in your at-home routine, and what you're going to be doing here in the treatment room with us. And we take it slow. Like, we're not in the market to do a whole overhaul on your routine and send you home with 12 products. Like, I'm a mom of two. I don't have time for that. Like, I want two things that work really well. And I think going low and slow is really how we get the best results. And it's funny, sometimes people sit in my chair and they're like, yeah, they're so dead set on this one treatment. Like, okay, I want masseter tox to slim my jawline. And I have that conversation with them of, you're actually not a good candidate for masseter tox, and here's why. But here's some other things that I can recommend to you for facial slimming. So I think that it's fun when patients come in and they're set on one thing, and we kind of take a step back and broaden that whole scope of, look, I hear you, but here's why that's not a good treatment for you, and here's what we would recommend.
No, that's great. So I think right now I want to bring up some of the listener questions that we've gotten for this week's episode. So the first one that we have for you today is this listener, they're at the age of 70. Is it too late for new skincare routine, Botox, laser treatments? Can you help with that, listener?
That's a great question. So I think that question resonates with a lot of listeners. And I will say anyone who's probably over 60 sitting in my chair always tells me, I think my skin is too far gone. And I look at them and I always tell them there's no such thing. And I firmly believe in that. I think that if you're ever at a place where you're ready to make change, we can make change. I think it's being realistic with our expectations, one, which is something we talk about, but two, we can always get a degree of improvement in the skin. And we know just in general, the pollutants that lie outside, UVA, UVB rays, free radicals, all these things that cause havoc to our skin, even just providing a protection. Like, let's get you on a vitamin C that's going to neutralize free radicals, that's going to brighten the skin. Let's talk about if you're using sunscreen. Something just as small as that can really carry, where are you at and what are you going to look like in 3 years from now and in 5 years from now? And when you're 70, 75, you still have 3 and 5 years to go. And so you should never feel that I'm too far gone. You can always sit in our chair and we are always happy to guide you towards skin health change.
Yeah, let's keep those skin cells healthy right where they're at right now.
Exactly.
Okay, so this is kind of the opposite side of the spectrum. With so many things out there, it's hard to know what's a good go-to and to keep your skin feeling young and fresh. For those who are in their mid-30s, or mid or late 30s and don't want to do anything that feels artificial like fillers, what's the best bang for your buck? What's going to keep me looking the way I feel?
That's a great question. And I think that I resonate with that because I remember after having 2 kids, I looked in the mirror and I was like, wow, I feel like the life has been sucked out of me in the best way possible. I love my babies so much, but it definitely changes the way that you look and you view yourself. And that changes through every decade to come. And here at Bare Radiance, we kind of talked about earlier, we don't lean into those filler first models. We really talk about skin health. And so I'll get a generalization here. When we're in our 30s, we should be doing things like microneedling to stimulate some collagen. If we have a lot more sun damage to the skin, then maybe we should be talking about some lasers like a Moxie or a BBL, because those are really changing the skin at the fundamental level. So I think that those are really things, and making sure we're on a good skincare routine in general. Those are things in our 30s that we really should be well concentrated on. But it's so different because when that client tells us, I want to feel like me, and this is what I used to feel like, right? Those are the clues that it's going to allow me to provide a really good treatment plan, right? Like, is it the fine lines and wrinkles that we're dealing with? Then we'll talk about microneedling. Is it the sunspots that we're dealing with at 30 because we spent most of our life in Southern California baking in the sun, right? Then we're going to be talking about a laser. So it really is individualized to each person. But I think generally in our 30s should be the decade of collagen stimulation and really forming healthy skin.
No, that makes sense. And I really resonate with this listener. I mean, I'll be 36 this year. So just, I think once you hit your 30s, you're like, I have to start taking my skincare seriously. And maybe that's just people speaking at you, in the back or social media. But I think it is important and it makes you feel good. And it's your 30s that you start to notice things that just pop up. So.
And it really could be something as simple as like, let's hone in on 2 skincare ingredients that are really going to carry you through this next decade. It doesn't need to be a whole overhaul. And it's crazy that the impact that even just incorporating a vitamin C, studies can show that it decreases fine lines and wrinkles. It helps with skin pigmentation. So not only is it going to provide some corrective capacity to your skin, it's also going to protect your skin from aging. And so I think that that's the misconception that a lot of people have is, oh my gosh, I need to do all these things to make a total overhaul. And it literally could be something as simple as we need to swap one ingredient and this is the one we swap.
Okay. Now this listener question I really love. It says, convince someone who doesn't want cosmetic treatments to why they should.
That's a great question. And as a provider, it's very important to acknowledge that I'm not in the business of convincing you to do anything that you are uncomfortable with. So if you're at a time that you are comfortable in your own skin and you don't have any concerns, right? I'm not in a position to convince you to do any of these things. Don't do that. That's my answer. Like if we're at a game and you're like, I need you to convince me to have this treatment, my answer to you is don't get the treatment, but come back to me when you're starting to have some concerns. And then we can walk you through how to guide you through that. People can view aesthetics as a business-minded entity, and that is not it for us. We're a medical entity. We're a client-first entity. And if you don't have concerns and you don't need something solved, then that's okay. And that's a great place to be. There will become a time where you do have some concerns. And when that arises for you, we've got an open door policy. So come on in.
I love that. When you do have concerns, come on in. Exactly. And everyone's concerns are different. Like we were talking about my forehead. Like I just wasn't ready for the maintenance of some of those like Botox and fillers and stuff like that for my forehead. So that just wasn't a concern for me right now. But if you ask me about like my sunspot right here, it's like, no, that's something I look at every single day when I put on makeup and it does bother me. So it's like, what's bothering you right now with your skin like health, and what could you address right now? And if there's nothing, great. But if there are things, that's what you need to be talking about.
Exactly. Like we provide a treatment plan corresponding to what the client's concerns are. Like I'm not here to be like, okay, we need to discuss these 5 things today. No, what is concerning you and how can I help you achieve the best result for that thing?
So what, in your opinion, should people be looking for when it comes to choosing a provider to make sure they're getting that kind and thoughtful, natural approach?
Absolutely. So I think there's 3 really important things when you're trying to vet a provider. One of them is their listening skills. So much like I said, when someone walks in the door, if your provider is already telling you the 5 treatments that you need to have done before you even had a chance to converse about your concerns, that's a red flag to me. I think a provider needs to be a listener first and then draft a treatment plan based on what your concern are, right? Like if someone comes in and they're like, never thought about their lips being an issue for them, and I start talking to them about all the ways we can fix their lips, right? That just doesn't feel good. And I think that listening is a number 1 key to really have a good client and provider relationship. Number 2 is credentials. So in aesthetics, you really need to have a strong understanding of anatomy and safety. And what credentials does the injector have? Ask them, when was your last course that you went to? When was the last time you were certified on this? Do you still have an active license? You guys are consumers, and it's important for you to not be afraid to ask those questions. Like, for example, in 2 weeks, I'm headed off to Tennessee to do a complications training with Dr. Subio, and it's literally a whole weekend talking about aesthetic complications that have happened over the last year and what us providers do to fix them. And I always learn. I mean, I go to conferences constantly, and the day that the provider stops learning is the day that they are not doing the best that they can for you. And so I think continuing education and making sure that they have the ability and the certifications to back them up is really, really important. And then I think number 3 is listen to the provider and let them say No. And I think that having the power to say no to a patient is so important, because if someone comes in with a concern and, for example, like master Botox, I want master Botox to slim the jawline, and you're not going to get the result that you want out of master Botox because you're not a good candidate for it. There are providers that could just give you that treatment, charge you for the treatment, and send you on your way, say la vie, have a great day. And I think that that's where having a provider that sets boundaries and says, no, this isn't what's good for you, and here's why, that is equally as important as having a provider who will treat you, probably even more important. So I think that those are kind of the three things. And also just validate them. Most of our clients come from referrals by other moms or other people, like, hey, I saw my friend on the soccer field. She says she comes to you. Her skin is looking great. I couldn't even tell that she had something done, but she just looks so phenomenal, and I want to see you. So lean into like your mom groups and your friends and ask them where they're going. You know, Google reviews are a really good way to see unbiased opinions, but I think that's always a good way to kind of vet the providers that you're seeing.
I love that we're talking to the women in the listeners, but I also want to talk about, because I know that you treat men too.
Yes.
So for any of the men that are listening, what do you have to say for them?
Yeah. So I think men, they're finally starting to kind of get on the wheel and lean into skin health too. So I feel like in the last year or so, we've really had an increase in male clients, and their concerns are actually very similar to what we have as females too. Fine lines and wrinkles. A lot of them will come in about under eye concerns. And it's really exciting to see men kind of starting to take care of their skin. So we draft whole rounded treatment plans for males too. And come in together, bring your partner in, bring your friend in. We're happy to kind of sit and walk you both through your treatment plan. Men age differently than women in general. And so treating a male is completely different than treating a female. So sometimes the recommendations I'll make to our female clients, they're definitely different than the recommendations I make to the male clients. So I think it's important that men come in, they get their own consultations, and not just listen to, oh, well, my wife's getting 20 units of Botox here, so I probably need that too. You don't. You need something different.
Do men have thicker skin than women? Just out of curiosity.
Absolutely, they do.
Okay.
So this is a pro tip, actually. One of my clients just asked me this the other day. She was getting a red light therapy device for her face. And I told her, order the men's mask and the red light therapy, and they have deeper wavelengths because men's skin is thicker to penetrate deeper skin. So they do. That's a true fact.
Okay. So what about some of those red light masks? What is your expert opinion on them?
Yeah, I think red light devices are great if they can be used consistently. So consistency is the most important thing with a red light mask. If you're not putting it on the skin at least 5 times a week, don't do it.
It's good to be honest. Like if you don't have time for it, then you're pretty much wasting your money. It's just going to sit on the shelf.
100%. And if you're using it once a week, I'm sorry, but it's not doing anything. And so I think that I'm at a point in my life right now that I don't have time for red light therapy, and that's okay. There may be a season where I do. But I tell clients, you know, we'll meet you with where you're at, you know? So if red light therapy is not in the cards right now, then let's talk about something that's more manageable for you to incorporate in your routine.
Right. Well, Tori, thank you so much for this conversation. Looking into the rest of 2026, especially with your grand opening at Larkridge, what are you most excited about?
Yes, so we have some really excited news. We are expanding into our own bigger location in Larkridge in Erie. It's kind of on the border of Erie and Thornton, Colorado, right off of Highway 7. And we are so excited. I think the most pivotal moment for me when designing this space was I really wanted to make it intentional and thoughtful for my clients. Like when I walked through, I was like, what are they going to want to feel like? What are they going to want to smell? What are they going to want to feel? And we really, every part of this build out was crafted for you and for them. And I can't wait to get everyone in the space and really feel what we created. So we will be in there this summer. We're going to be having a sunblock party, which will be July 18th. So more details to come on that soon, but it's really welcoming the community into a space that we've built that blends science, art, and really genuine connection.
And if someone's listening and thinking, okay, I'm curious, why Bare Radiance? What do you have to say about that?
I have to say, come in and experience it for yourself. Bare Radiance isn't a place where you are going to have us sit across from you and we're going to fix one thing and send you on your way. Bare Radiance is a culture, it's a community, and it's a really well-rounded plan where we want our clients to feel seen, heard, and connected. And so we have really fostered that environment here at Bare Radiance. And my answer to you is come in and experience it for yourself.
Well, Tori, thank you so much for educating our community on this particular topic. I really appreciate your intentionality, kindness, thoughtfulness, and your expertise in this field. You can tell that you're really well versed, and you do keep up on your continuing education classes, and we're really excited for this grand opening in Larkridge.
Yes, Lauren, thank you so much for having me. You have been a wonderful host, and hopefully we have more partnerships to come.
All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time. Thank you so much for listening to today's episode of the Erie Wellness Podcast. If something from this conversation resonated with you, I hope you'll take it with you into your week or share it with someone in our community who might need it. To subscribe, just head to the main page for the Erie Wellness Podcast, right where you're listening, and tap subscribe. And don't forget, when you start to feel better, you start showing up better in all areas of your life, and you deserve that.